COVID-19 pandemic has definitely increased health financing in the last couple of months on an emergency basis. It will be very difficult to sustain that level of health financing and attention to health. What we do need to see is a move from a lot of emphasis on curative care and hospital infrastructure to public health, health prevention and health promotion. And we do hope that this pandemic has brought attention to the importance of public health and to making sure people can have healthy lives and are well protected from all kinds of diseases. When it comes now to health financing in the future, definitely looking at the economic difficulties that we will face, looking at recession and decrease in economic growth that this pandemic has brought about, it will be very important to create innovative financing solutions for countries which either make health lending from development banks very attractive, or which help them to raise money through the private sector or other ways so that they can sustain their commitment to the health sector. Because what this pandemic has definitely shown is that while health might not be everything, everything is nothing without health. And that if we don't invest properly in the health sector, we have to pay afterwards. I mean, that's what we see with the pandemic right now. So definitely what we need is innovative health financing solutions, making sure that we sustain the commitment from governments to invest in health and to invest not just in curative health and treatment, but really in health, public health, health prevention, health promotion, and also, of course, health education. That is equally important. I have managed ADB's Malaria and Communicable Diseases Threat Trust Fund for several years, and we always linked malaria with public health and with health security. And there are two entry points. Number one is often those people who get malaria in Asia Pacific are vulnerable. They often live in rural areas. They work in the informal sector. So malaria is a disease of people who already have weak access to health services, and that's something we need to address. So malaria can be a very good indicator to show if we actually reach people who are more vulnerable and if we reach people who have difficulties accessing the health sector. In other countries, of course, we do also have urban malaria, like in India, and it's a different story there. But in any case, malaria is a good indicator to see how good access, how well we are in providing health services and access to health services for vulnerable population groups. In terms of health security, malaria definitely is an important disease to consider, especially if we think of multi-drug resistance malaria. And we had a huge program in a couple of years ago in the Greater Mekong sub-region, and there is continuous effort, of course, from the Global Fund and from various other partners, and of course that's why we have APLMA, to make sure that drug-resistant malaria is controlled and does not leave this particular region and doesn't reach Africa. So drug-resistant malaria is a health security issue, and we need to ensure that attention to this problem continues, and that we, after this pandemic, have learned our lesson and recognize that health security is something that we must invest in as a country, as a region, and as a world.